Vitamin D, the powerhouse nutrient and its deficiency symptoms. 1. Vitamin D, often called the sunshine vitamin, is a fat-soluble vitamin essential for overall health. 1. Unlike other vitamins, it functions as a hormone, impacting multiple systems in the body. 2. The body synthesizes vitamin D when the skin is exposed to sunlight, specifically ultraviolet B, UVB, rays. 2. It can also be obtained through certain foods and supplements. 3. Vitamin D exists in two primary forms: D2, ergocalciferol, and D3, cholecalciferol. 3. While D2 is found in plant-based sources and fortified foods, D3, derived from animal sources, is more effective in raising blood levels of vitamin D. 4. The role of vitamin D in calcium and phosphorus absorption is crucial. 4. It facilitates calcium absorption in the intestines, ensuring strong bones and teeth. 5. Deficiency of vitamin D leads to rickets in children, characterized by weakened bones and skeletal deformities, and osteomalacia in adults, resulting in soft bones and increased fracture risk. 6. Low levels of vitamin D are associated with increased susceptibility to infections due to its critical role in immune function. 7. Vitamin D deficiency symptoms vary among age groups. Infants and children: weak bones, delayed teething, muscle weakness, irritability, and growth retardation. Teenagers: bone pain, frequent colds, fatigue, poor growth, and mood disorders. Adults: persistent fatigue, muscle pain, joint stiffness, depression, increased risk of fractures, and autoimmune disorders. Elderly: osteoporosis, cognitive decline, weakened immunity, and heightened risk of falls. 8. Scientific studies suggest that vitamin D regulates over 200 genes and influences cell growth, inflammation, and neuromuscular functions. 9. The link between vitamin D and mental health is profound. 9. Low levels are associated with depression, seasonal affective disorder, SAD, anxiety, and cognitive decline in older adults. 10. Adequate vitamin D levels have been found to reduce the risk of chronic diseases such as cardiovascular diseases, diabetes, and multiple sclerosis. 11. It plays a significant role in preventing cancers like breast, prostate, and colorectal cancers by regulating cell proliferation and apoptosis, programmed cell death. 12. Vitamin D enhances muscle strength and function, reducing the risk of falls in the elderly, which is a major cause of disability and hospitalization. 13. It modulates insulin secretion, making it crucial in managing type 2 diabetes by improving glucose metabolism and reducing insulin resistance. 14. Deficiency during pregnancy is linked to gestational diabetes, preeclampsia, and low birth weight, emphasizing the need for adequate intake among expectant mothers. 15. For individuals with darker skin tones, the natural melanin reduces UVB absorption, leading to a higher risk of vitamin D deficiency, necessitating supplementation in many cases. 16. People who work indoors, use excessive sunscreen, or live in areas with limited sunlight exposure are at risk of deficiency, requiring dietary adjustments or supplements. 17. Recommended daily intake of vitamin D varies. Infants, 0-12 months, 400 IU, 10 mcg. Children, 1-18 years, 600 IU, 15 mcg. Adults, 19-70 years, 600 IU, 15 mcg. Elderly, greater than 70 years, 800 IU, 20 mcg. Pregnant and lactating women, 600 IU, 15 mcg, with some experts suggesting higher doses. 1. Sunlight remains the best natural source of vitamin D. Spending 15-30 minutes in direct sunlight, without sunscreen, a few times per week can maintain adequate levels, depending on skin type and geographical location. 2. Vitamin D-rich foods include fatty fish, salmon, mackerel, sardines, egg yolks, fortified dairy products, mushrooms, and cod liver oil. 3. Vitamin D supplementation is often necessary for people with deficiencies. 3. D3 supplements are preferred over D2 due to their superior bioavailability and effectiveness. 4. Excessive vitamin D intake can lead to toxicity, causing hypercalcemia, high calcium levels in the blood, kidney stones, nausea, and confusion. 4. The upper safe limit is around 4000 IU, 100 mcg, per day for adults. 5. Emerging research highlights the role of vitamin D in autoimmune diseases like rheumatoid arthritis, lupus, and multiple sclerosis, indicating its potential in modulating the immune response. 6. Vitamin D receptors are present in brain tissue, highlighting its role in neurodevelopment, cognitive function, and protection against neurodegenerative diseases like Alzheimer's and Parkinson's. 7. Athletes benefit from adequate vitamin D levels as it enhances muscle performance, reduces inflammation, and accelerates recovery from injuries. 8. Seasonal variations affect vitamin D synthesis. 8. During winter months, people in higher latitudes may require supplementation due to limited sun exposure. 9. The gut microbiome and vitamin D are interconnected. 9. Recent studies suggest that sufficient vitamin D levels promote a healthy gut flora, reducing risks of inflammatory bowel disease, IBD, and leaky gut syndrome. 10. Vitamin D aids in regulating blood pressure and cardiovascular health by improving endothelial function and reducing arterial stiffness. 11. In obese individuals, vitamin D gets sequestered in fat tissues, reducing its bioavailability and leading to higher deficiency rates. 12. Individuals with chronic kidney or liver disease have impaired vitamin D metabolism, requiring careful monitoring and specialized supplementation strategies. 13. The synergy between vitamin D, magnesium, and vitamin K2 is vital. 13. Magnesium activates vitamin D, while vitamin K2 directs calcium to the bones rather than arteries, preventing vascular calcification. Conclusion. Vitamin D is a crucial nutrient affecting nearly every system in the body. From bone health and immune function to mental well-being and chronic disease prevention, its significance cannot be overstated. Deficiency is widespread across different age groups, necessitating conscious efforts to maintain optimal levels through sunlight, diet, and supplementation when required. As research continues to unveil new benefits, ensuring adequate vitamin D intake should remain a priority for long-term health and well-being.